Good morning, everyone, and welcome to this COVID legal compliance webinar. My name is Nihal Samara. I'm the General Counsel and Legal Director here at Kaizen Synergy Law Firm, and I'd like to welcome you all to today's session. These sessions that we are running form part of a series of webinars that we are running each week. We will be running these and continuing to run these, should I say, over the next upcoming months, each week on a Tuesday morning. It has been widely received. We've received a lot of wide feedback from agencies. Delighted to see some of the resources that we are putting together, and I'm delighted to see you all join us today. Over the last few years, we've certainly been running these webinars almost weekly around it, and the idea of these is to really keep you up to date about specific legal compliance obligations that your agency needs to know about. We will and often do drill down into different states and territories to make it relevant for the different agencies that are joining us each week. Over these weeks, we often will see thousands of agencies actually join us during these webinars, and we are delighted to have you all visit us on Tuesday morning and participate in these webinars. As always, if you do have any questions, by all means, use the chat group and questions panel on your web conference view, and you can raise questions as we go as we move throughout today's session. All of the webinar slides will be made available to you after today's session, along with any other resources that we refer to as well. Today's session focuses on the management of long COVID and really actually starts the discussion, and we will be continuing this in the upcoming webinar series as well too, around the management of long COVID in the workplace. The workplace will form in 2022 the centerpiece for compliance obligations, specifically around COVID. We are seeing we're seeing in different states and territories quite openly the push of governments and departments and regulators onto increasing the compliance obligations for agencies and employers in terms of managing COVID. What we are going to focus on, as I mentioned, is around this discussion of long COVID, and we're going to actually start to pull information from the NHS in the UK. There is discussion about opening up policies and a range of things that are happening over there. But in saying that, we're actually going to look at some of the specific obligations that your agency needs to consider as we move into this phase of management of long COVID and the impact that it has on the workplace itself. So today's agenda is to really build off the previous webinars that we have run. Last week we looked at workplace rules and returning to work, and we're going to start to build off this again today. We're going to look at the management of long COVID in the workplace. What does it mean? What is it? And what are the legal management arrangements that your agency really should start to consider? And some of these, we've started to actually update policy documents for agencies as well too, because of this particular space that agencies are moving into. As always, we are going to show you some case studies of what other agencies are doing to make their legal compliance obligations easier. We do acknowledge the traditional owners from where you are all joining us today. While this webinar is being recorded and will be published on the Gemba 360 YouTube channel, we do pay our respects to the traditional owners accordingly where you are all joining us from this morning. As always, we just like to put up the recommendations and as part of our presentations to show you where we're actually heading to. What we are going to focus on and recommend is that you actually look at your COVID-safe HR registers and also look to avoid penalties, which is what everybody really wants to do in order to meet your work health and safety obligations. But what does this actually mean, and what is involved in this is what we are going to unpack today. Next week, we are going to be looking at implementing HR COVID-safe workplace forms and policies and roadmaps. And this will build off the long COVID and COVID plans that your agency, COVID safe plans that your agencies should be updating and have in place. So, what is long COVID? It is something that is starting to be spoken about, but the idea of what it actually means is still new to many agencies. So, when we've actually looked at, and our basis for this is looking at peer reviewed clinical literature and also pulling it from multiple data sources itself. So rather than just pulling out one specific piece of information, we are looking at multiple research papers, public health research papers, multiple documents and multiple data sets, and with a view that if it all points to the same outcome and position, then there is substance from a public health perspective of what is being spoken about here. So essentially, many people are experiencing health difficulties for several months after they have been infected with COVID-19. There is work underway to make sure that healthcare staff have more information about the longer term effects of COVID-19 and how to look after these particular patients safely. And this is due to be published in the National Institute of Health and Care Excellence, NICE, in the upcoming months. Research does suggest that most people can expect to recover from COVID-19 within about 2 or 3 weeks. And with that, there are obviously impacts on your agencies when you look at people's sick leave time, leave that they may need to take. You may need to look at when they return to work. Some of this stuff we have spoken about last week, and we'll build on in today's session. So when people are taking 2 to 3 weeks off, and when I say off, to recover from COVID, with data suggesting that around 10% of people that suffer symptoms for more than 3 weeks. So essentially there is analysis of unpublished management information extracted in the UK, which is where we're basing this on, from electronic staff records, HR, payroll, system information that indicates that the average duration of disease among staff is similar to that seen elsewhere. Now, when we see this, the post-COVID syndrome and what people can actually expect to see is that there are symptoms that may occur actually 12 weeks after, and that includes fatigue, breathing problems, muscle and bone pain, headaches, brain fog, confusion, thought disorder and dizziness, nausea, bowel changes, indigestion, persistent fever or rashes, ongoing loss of smell and or taste, worsening diabetic control or worsening underlying metabolic disease, as well as sleep problems, mood changes, and a range of other health issues. What is also being received from some of the Victorian PCPs is that when in discussions yesterday, is that there are reports that some people and workers can't actually walk upstairs. So all of a sudden we see that there are actually quite significant workplace issues that can actually come up as a result of COVID-19. And this is essentially post-COVID syndrome is a real condition. And there is papers like this from the Royal College of General Practitioners that are actually talking about that this is actually a real condition, and GPs should believe you, listen, show empathy, and acknowledge the diagnosis. So there is already movements around this, around essentially health issues that are resulting from long COVID. Now, essentially what we're then seeing is that estimates suggest that about 93% of absences in the workplace related to COVID-19 sickness has lasted for less than 30 days, and over 99% lasted for less than 3 months. What we are seeing is that for a small number of staff, this has actually lasted for a longer period. And these include staff who have become seriously ill through COVID-19 and suffer long-term absence with the need of extended recovery and rehabilitation. Staff who have experienced lingering symptoms after a COVID-19 infection, resulting in continuous or intermittent absences related to their original episode that they've actually got. So what is commonly known as, and this episode is commonly known as long COVID. So for many individuals, long COVID presents as relapses or a range of symptoms, whilst others struggle with actually a single symptom on its own. So at this early stage, the long-term impacts of COVID-19 are actually not fully understood. So when we look at this, and where this essentially leads to is the management of long-term COVID-19 and sickness absences. And places like the National Health Service, the NHS, has already started issuing policy documents and guidance on the management of long-term COVID-19 sicknesses and absences. And essentially how this is then managed within the workplaces is where we start to link in for agencies like yourselves. So with this, there is the requirement still from a work health and safety point of view around screening clients, personnel, and people returning to work. What we're looking at here is how you can manage your legal compliance obligations effectively and efficiently without causing an entire review of your staff compliance obligations every time something changes. Now, this is the slides that some of the slides that we actually put up from last week, and we are going to continue to build on these as well too. And essentially, when we look at workplace checklists, and this is all managed on your Gemba dashboard as well too, you do have access to the templates of your COVID safe plans, looking at capacity, record keeping, face masks, signage and cleaning. All of these requirements is still things that you need to consider doing and ongoingly do over 2022 within your agency. As I've mentioned, you do have access to these on your Gemba dashboard, and the resources are also listed here. One of the things I will add here is that by attending these webinar series, you should get a better understanding of what the COVID rules are, improve your awareness of your HR compliance obligations. We will be sending you out a timely collection of resources as well too, and you should also see what the COVID safe systems that other agencies are actually doing that are actually working to meet their legal compliance obligations. I will add that this webinar is being recorded all the way up to the Q&A part of the session. You can ask questions in the chat group. The webinar is published on our Gemba 360 YouTube channel, as it is a open public health webinar that we are running, and all materials that are being referred to will be circulated to all attendees. The webinar information, as I have mentioned, and the recordings can actually be viewed either on our website, which is at our kaizensynergy.com, or you can go directly to our Gemba 360 YouTube channel and view all the past public health webinars that we have run. For those of you that are getting the Gemba login for the first time, you can access that directly off our website or go to gemba360.com. And we will be sending you your username and login details. And you can get all of the resources on here, including the new policy templates that I will be referring to as well too. And these are listed actually under the Gemba Docs area, and they're listed under COVID policies, and you can see those here as well too. And you can actually access those today if you like as well. So the Gemba dashboard also has all the COVID forms that I'll be referring to today, and you can access these and view these as you need to as well. And you will be given access if you don't already have access to this today as well too. So essentially what we're talking about today is around work health and safety and COVID safe obligations, especially when we're starting to talk of long COVID. And it is a real thing that agencies need to consider as part of their work health and safety plans. The work and the legal resources that we're talking about and referring to today, I've said this in our previous webinars, is based on our current legal works that we've done up to date to support agencies. And this covers just about every aspect of COVID-19. We've set up testing services. We've helped agencies set up vaccination clinics and legal agreements and health promotion plans, as well as safety and service documents as well too. In the current context, and let me just phrase it as this, there is the changes around mandatory vaccination rules as well too. This is being extended out to manufacturing in some states. Aged care workers have obviously been covered, healthcare workers, but now there are also looking at hospitality workers and schools as well. There is essentially this need now from your end to consider COVID-19 work health and safety obligations. And we manage this in a number of ways. The first way we look at this is your obligations to your clients. Generally when we talk of work health and safety obligations, and this is even screening clients for long COVID, when we initially talk about work health and safety and the work health and safety laws, most agencies will focus on their agency or their staff, but miss the requirement for their clients. So essentially, clients may visit your agency, they may come in, and there will be different types of clients that you're seeing now. So there will be some that are fully vaccinated and consider that they're fully vaccinated after having 2 jabs. But now we're already seeing that that's now being extended to 3 jabs for some groups. There may be people that are partially vaccinated, had 1 or 2 jabs. There may well be people that are exempt because now with the number of increasing people that are actually having COVID, whether that be New South Wales. I mean, when you look at it, we started the year with some 141,000 active COVID cases in New South Wales alone around this. And so people may actually seek to get an exemption because they've had COVID. There may be people that are not vaccinated, and there may also be people that are COVID positive. So as part of this, your obligations to your agency is that you need to screen people that are coming in. There are a lot of agencies that may provide housing and disability support services as well too, and run group sessions. So in order to provide safe services to your clients, you do need to very carefully consider screening clients and what happens if somebody fits into one of these categories. What will you do if somebody is positive? Will you not allow them to come in for the class or get services? Or there may be people that you actually do want to allow in because they are a vulnerable population group. An example of that is we support a number of Aboriginal community-controlled organisations, and there are some people that, as part of their COVID support services, they are coming in as COVID positive. Or there may be schools that we also support as well too, and there may well be services that they need to run. So again, how you're actually screening clients is also something you need to consider, and we will cover those off shortly of some of the options. Now, this also means that if you are visiting a client as well too, how do you ensure that you've got safe, reasonably appropriate, safe work environments for personnel that are actually going out and visiting clients? And we see this in circumstances where there may be support to aged care services in their own home for disability clients as well too, that your agency, either volunteers or paid staff, may actually be going out to visit clients as well. And we see this in some of the migrant refugee centres that we've provided services to. And again, what is the screening process that you have, and reasonable precautionary measures that you have in place to either support that client, or there are some agencies that have actually said, look, we're not in a position, if the client is positive, to actually provide those supports. So there are a range of different considerations that your agency needs to consider. And this also includes if you're engaging with another agency. So you may broker out services, and in the past webinars, I've discussed about putting in and reviewing service agreements and inserting what we call force majeure clauses, where you require agencies either to support you by providing things like their vaccination status of personnel, but again, consider how you're going to manage that information. And we're going to discuss this in the HR part of the section for the GEMBA dashboard as well. But again, disclosing that information, there are some agencies that may not want to give you information about their personnel, or may want to provide just a statutory declaration. But you also need to consider, well, what is the responsibility of your agency to clients in ensuring that people that are going out do meet the requirements under specific legislation. But there may well be that staff or personnel may need to be vaccinated. They may be partially vaccinated, but also screening clients at the other end, depending on what status they actually have. So when we look at the client workflow, what is important is to firstly look at what is your compliance or legal compliance obligations. And agencies often ask us, well, where is the line in the sand, not to work out the minimum requirements, but where is the line in the sand to say, look, we've done what is all reasonably practical. And part of this is to look at what firstly the legislation says, look at what is the directives coming out of the various Commonwealth and state and territory health departments, and what is the relevant COVID safe plan. Now, by doing that and stepping that process, that's what we've done within these slides and giving you the resources in order to, I'm going to say, leapfrog you a little bit into understanding what your obligations are. So essentially, what we've broken these down into is a series of checklists and self-assessments that you can do. Now, as part of this, what we are seeing when we talk about clients visiting your agency is to set up screening tools that you can use. And this is an example of one of those such screening tools. Now, it is obviously a QR code, and you can do this with us as well too, if you like. But essentially what this gives us is an easy to use form. And we've got one that's set up here, and it gives you an idea of how it actually works. Now, I will just show you how this works, and you yourselves can actually log in and use this if you like. And I'll actually just show you how this works at your end. Now, what one of the most effective things that agencies have done from a work health and safety point of view is to actually use the client screening tool for this. And we've added this on as a Google form that connects directly into your screening form as well too. So essentially what we have done, and if you use the QR code, you'll see that on your phone, it'll suddenly pop up with a link here. And what we have here is a copy of one of the forms that we've used. And this is for one of the religious groups. They wanted a client screening tool. And essentially, it's their name, their contact number, and essentially a few questions that they can ask us here. And this was also used by a housing agency as well too. Once that's completed, it will then send off the information into the Gemba dashboard. Now, what's important here is that if somebody marks their question as yes, that they have had one of these symptoms, once it jumps in to the Gemba dashboard, what you will see is essentially this, and it's a contact tracing form that allows you to get alerts about what is actually going on. And let me just show you how this works. So essentially, when I want to have a look at my forms that are here as well too, and if I go back to the dashboard, here we are, if somebody answers yes, then essentially the information will go directly into the COVID tracing button here. And what I see is a list of all of the forms that we have. And here it is here. And essentially I can go back and look and view at all of these forms. It has the date, it has the time, it has the information that we have, but most importantly, the date, the time, wherever your agency is based, is actually recorded. And you've got this information on here as part of your work, health, and safety reporting requirements. If somebody marked yes in the field, then it will automatically send you an alert directly to your email to say, hey, this person has actually marked in yes. And it becomes something that your agency can then very, very quickly jump on and view. So essentially, by having this tool in place, it allows you to run the screenings that are there. What it means is that you can very quickly identify whether people are fully vaccinated, partially vaccinated, exempt, not vaccinated, or maybe COVID positive as part of this. And you're starting to meet your work health and safety obligations. Now, where all of these legislative requirements come from is essentially under a specific set of legislation. And to date, these have been really found under the some sort of public health legislation. In Victoria, New South Wales and Queensland, and we're seeing it now in WA with discussions around specific updates, and I'll come to that in a minute. But essentially, there are a series of legislation relevant to each state that talks about specific legal requirements and directives that are provided. And some of these are under the mandatory vaccinations, which you would have seen. In WA, essentially as of the 21st of Jan, when we looked at this, and these are some of the slides, that the state was planning on actually shutting indefinitely, and there were a whole range of news articles about how quickly things are changing. In WA, there are the public health and social measures that they are talking about, that essentially the transition date is for Saturday the 5th of February. So it is coming up, and essentially a range of new guidelines that are coming out. And this essentially is what we're seeing, the movement of current state authorities. There is also the need for proof of vaccinations in specific areas as well. But what we're seeing is that a lot of government departments and agencies are talking about businesses, and the terminology that they're using is very, very loose. They're actually saying things like businesses should consider their own individual circumstances and seek their own legal advice before adopting a proof of vaccination requirement. So, and this is often reflective in other states and territories as well too. If we look at things like Victoria, then going back to the 15th of October, there was the imposition of updated obligations on employers of vaccinated workers, and these updated legal requirements impose new document management obligations on agencies. So essentially, and I'll just flick through these because we've run through these in the past webinars, but there is the obligation to collect, record, and hold vaccination information about a worker. And if a person was considered to be partially vaccinated, then you needed to then consider what documentation you needed to supply and what work that they could actually undertake. If a worker was considered to be unvaccinated, then essentially the rules that as they stood was that you cannot actually permit a worker who is unvaccinated to work for your agency outside the worker's ordinary place of residence. So essentially, picking these up, what we are seeing is that the states and territories are almost individually going at different speeds, but are actually ending up in quite similar places. And I'll just pick up Gabrielle, who said the WA open date has been deferred. No new open date has been announced. That's correct, Gabrielle, as part of that. But I wanted to add, as part of what Gabrielle's talking about here, is that while those date has been deferred and no due date has been placed in, what we are seeing universally across the country is the National Work Health and Safety legislation. And under those pieces of legislation, agencies do have a requirement to essentially ensure that they're taking reasonable steps to manage COVID within their agency. And now that we're talking about long COVID as well too, it is around what compliance systems you've got in place, what screening systems you've got in place for clients, but also your personnel as well. And so we're seeing in other states, and this is picking up Gabrielle's really great point, in other states, they've actually started to enforce this by actually looking at penalties for non-compliance of these public health directives. And also in some states, which I will add, they've actually issued, and this is actually building on previous legislation, where there was the introduction and amendment to what we call the Crimes Act. Now, the Crimes Act traditionally in different states and territories will cover things like burglaries or crimes that you would expect people to have. So burglaries or murders, manslaughter, all kinds, theft, all kinds of crime, criminal activities. What the Crimes Act has actually changed, for example, and I'll just use the Victorian example, for example, is that a person who knows that a document or thing that is reasonably likely to be required in evidence in a future legal proceeding and who destroys, conceals it, or allows somebody else to destroy or conceal it is actually guilty of an indictable offence. So when we look at this, the requirements for document management is actually now found in the Crimes Act. So when we're looking at things like why I'm talking around this is to look at placing all of your legal obligations together, whether it be under HR rules, whether it be under work health and safety, but also document compliance obligations is now something that is actually an indictable offence. And so we're talking of potentially, and this is actually dating back to 2006. So it was actually pre-COVID that it actually came in. Some actually, where are we now? Some almost 14, 16 years ago. So as part of this, we're now seeing that this piece of legislation is now being kind of flagged by different state and government agencies, where the penalty of this offence is up to 5 years or up to $64,000. And this is for documentation that may be used in a legal proceeding. So legal proceedings, and we're involved in supporting agencies with a fair work claim around COVID-19 and mandatory documentation. And there's also a potential class action as well too that we're supporting agencies on at the moment as well. And so those types of documents are clearly sitting within the document management guidelines as well too. So you can see that there are a range of workplace fines, and the same thing happens in also New South Wales, where they are actually imposing different restrictions and obligations on different workers, and we've got them listed here. In Queensland, we're seeing public health directives covering healthcare and aged care workers, quarantine workers, and essential workers also crossing into Queensland from other states. But what is consistent across this is occupational health and safety laws and work health and safety obligations. So under occupational health and safety laws, an employee can be a person, a contractor, a partnership, and this is why I've mentioned about any brokerage arrangements that your agency might have, franchising operations, not-for-profit organizations. And so the courts are actually using the broader definition of employees here. And so there are obligations placed on employers and employees, and it is important that all and both do what is reasonably practical. So when we talk of, we've spoken about screening, we're now talking about returning to work. And now we're going to lead into next week's webinar, where we are going to look at workplace forms, checklists, and tools to really move yourselves and give your agency these resources and support. From the checklist and management part, it is important that you have your COVID safe plan in place. It's important that you look at capacity, record keeping, face masks, and signage. On Gemba, you do have access to a range of tools, and if I jump straight into the toolbars here, you can see this information that's listed here as well too. And this does allow for you to utilize these for your staff and client screenings as well. As part of the COVID safe plan that we are actually going to look at in some detail next week, and this is showing you where we are heading with this, we're going to look at the compliance obligations covering off consistently the areas that government agencies are focusing on. And this is around physical distancing, wearing a face mask, practicing good hygiene, looking at record keeping and acting quickly if workers become unwell. And we've given you the salient points around this on what to do here, as well as avoiding interactions and creating workforce bubbles. Where the safe workplaces are in terms of what are the key areas within an office environment that you should be considering. Again, we've identified looking at floor markings, where to place hand sanitizers, record keeping, which is important for all visitors. And these are the sorts of systems that your agency can put in place. And picking up Gabrielle's point, essentially while the WA open date of the 5th of Feb has been deferred, essentially the systems that we're talking about here can actually be implemented prior to that to ensure that you meet those obligations. In terms of ensuring physical distancing, there are specific requirements that we're seeing across the different states that agencies have implemented. And this includes also wearing face masks, practicing good hygiene, looking at the different cleaning requirements that your agency needs to consider as well too. There is also and has been talk of agencies utilizing hot desking and why that shouldn't be your first option that you have, plus also looking at your checklist for record keeping and also what to do if clients or personnel become unsafe. I am jumping slightly through these a little bit as well too for time, but also because you've got these checklist tools on your Gemba dashboard on the left-hand side as well. We also recommend around avoiding interacting in close spaces and also allowing clearly the use of increasing essentially airflow throughout your agency if that is possible. There is the talks of things like workforce bubbles again, and the importance of rostering and looking at contact tracing within your agency as well. I have spoken about creating the COVID safe plan, and this is something that we are going to unpack next week and give you a copy of a COVID safe plan for long COVID that you can actually implement within your agency. What is important here is that outside the public health directives is that there is work safe and occupational health and safety legislation that your agency needs to ensure you have in place and meet as well. And with it, as I mentioned, what does work within agencies, and let me go back one slide, is around looking at some of the case studies and actually showing you what actually works. One of the things that does and has worked well is the daily attestation registers. And many of you would have heard me speak about this over the last number of webinars, and it frequently comes up. Essentially, this is a screening tool for all of your personnel. You can find this directly on your Gemba dashboard under COVID Daily Assessment. And if you click on this and I bring this up, it will bring up the specific COVID form that's for you based in your agency as well. And it asks a series of yes, no type questions. Keep in mind that if anybody answers yes, you will get a notification to your email, and it will also be loaded back into your contact tracing module as well. Quite simply, the importance of this is to ensure that your staff are being screened each day as part of their roles and responsibilities. Idea is that you're looking for any COVID symptoms that they might have. When we're looking and forward looking for trying to support staff and the reports of long COVID being out there, then essentially you need to have a look at whether people do have any symptoms, where they've actually come from, have they been in contact with people, is they getting better or worse, or are they maintaining their health status as well too. And as an employer, this is something you're going to need to consider. Two agencies that we refer to around this, one was Rumballara Aboriginal Cooperative and the other Laurie's and Women's Housing Limited. And I do thank Laurie Seville, the Chief Operating Officer at Rumballara, and Judy Lyon, the Chief Executive Officer, along with Lena Tompkinson, the Compliance and Executive Officer at Women's Housing, with, as well as Judy Lyon, the Chief Operating Officer as well. Now, what these agencies have done around this in terms of managing COVID over the last couple of years consistently has been utilizing the Gemba dashboard around this. We are going to look at the pandemic forms, and somebody's just asked us, do we get a copy of these slides? Absolutely. After today's webinar, you will get copies of all of these slides and resources. So essentially in this, you've got your policy templates, you've got your plans that you have, and importantly around this, what also Women's Housing Limited have done with the guidance, under the guidance of Lena Tompkinson, the Compliance and Executive Officer out there, is to look at some of their COVID daily assessment forms. And these are gradually being adjusted as things change. Now, importantly around this, they can also track whose and what symptoms people may present, but it allows them very, very quickly to keep on top of all of their compliance obligations. As I've mentioned, as part of the recommendations that we are making to all agencies is to set up and look at your COVID safe HR registers. You can avoid significant penalties by taking a reasonable approach around your work health and safety obligations. We encourage you to review the Gemba dashboard that you have access to with all the resources that we are sending through to you. Next week, we are going to be looking at the HR COVID safe workplace forms, policies, and roadmaps. Somebody has just asked, can we have a look just briefly at the HR tool around this? Yes, you can. You all have access to this, and you can simply access the HR module on Gemba to manage your COVID resources by simply clicking on the HR management button. And you can see that right in the middle of your screen here. What this allows you to do is essentially manage all of your HR compliance obligations and vaccination registers. It is also and has been previously used for things like working with children checks, police checks, emergency contacts for personnel and the likes, but really allows you to actually manage all of your compliance obligations in one spot. So if I click on the HR management button, this screen comes up, and I'm just picking up James's request to have a look at this before we finish up. So essentially what it allows you to do is to look at all people's personnel. I'm just going to say, yes, it does also do timesheets and leave forms and all kinds of things as well too. But what we are actually looking at here is specifically around the HR reporting side for vaccination registers. So if I go into Fred's profile and I just click on my info, you can see that I can record personal contact details, emergency contact details as well too, and update these, and people can update their own information as well. But more importantly, if I wanted to have a look at the what we call the license section, then we can actually record the COVID-19 registration, the COVID-19 vaccination, and also set up the issue date and also when the next review date is as well too. And we can also load in, and people can actually load in their certificate directly for you, and it's all in one spot. The great thing about this is that you can actually run reports anytime that you need to, and if people's vaccination status changes, it gives you a live report as your agency is, how your agency is traveling and what your HR compliance obligations are. With that, if you do have any questions, more than happy to stay online and answer any questions that you might have. If you are watching or listening to this recording after today's live session and you want access to the resources or the Gemba 360 dashboard, please reach out to us on 1300 360 360 or email us at support@gemba360.com.